All right, welcome back. So today we're going to go through the rest of the beginning part of the script all the way up until you start looking for the actual plans. Now, there's going to be a lot to this, and the reason for that is because when you're collecting information, it's not like you're going to be collecting information specifically and only for Affordable Care Act plans or ACA plans. You're going to want to collect as much information as possible so that you can take that information and offer other things like supplements, life insurance, dental, vision. There may be a lot more that your client actually needs, but you're not going to know that if you're only going into it with the mindset of, hey, I'm going to get the information I need to go ahead and put this person in a low cost Affordable Care Act plan. So we've already gone through in the previous opening. Hey, John, I'm Ian, just getting back to you about this form you filled out for info on low cost health insurance. You put your zip code as 85041 and your date of birth is 7/16/63. What we're going to be going through now is the full script and the questions. So we'll be going to right about here. All right, so moving on into it. So now you've introduced yourself. Great, I'm assigned to your request and we do everything virtually and this will only take about 10 minutes. Grab a pen and paper. So you want to kind of give them a timeline to work with, and then you also want them grabbing a pen and paper because it gives a little bit more credibility. They don't think that you're just going to try to fast talk them, and you want them to be as much a part of the process as you can. Next, I have a couple of things for you to write down. If they don't have a pen and paper, you can text them your name and your license number. So the first thing I want you to do is to write down my name. It's Ian Sanders. The next thing is my license number. It's 8771933. The state requires me to leave that with you so you can look me up if you want to on the Department of Insurance website, or give them a call so you know who I am. I'm assigned to your request so you can save my name and number. Now, the reason that you want to do that, there's two reasons really. The first one is going to be that you want to build credibility with that person. So the moment that you give them your license number, you give them your name, you tell them to write down your phone number, they now will look at you as a legitimate person. They're getting to know you a little bit better. The other thing is you don't want them getting info or getting other quotes or answering calls from other agents, because that's going to, let's say that you go ahead and you schedule an appointment with them, you go and another person comes and calls them right after and they say, okay, well, I'm going to go with this person. That helps prevent that, because now it's a lot more likely that they'll say, okay, well, I'm already working with Ian, he said that he's handling my request, I'm going to continue working with him. All right, so the next thing we're going to do is describe what's going to happen next. So now the way this works is very simple. I'm a licensed broker, so I'm like your personal shopper, and I take a holistic approach. So now you're eliminating their desire or need or thoughts that they need to go and get quotes elsewhere or look through the market to try to figure things out for themselves. And so what that means for you is that since I have access to about 30 different companies, my job is just to ask questions to find out what you're looking for and can qualify for, and to try to get you the most complete coverage possible that's within budget. Sound good? And then they'll answer, all right, great. Because everybody wants to get as much coverage as they can for as little as they can. So you're letting them know that you're going to have to find out their budget and that you're going to do everything you can not to just try to dump them into something, but to get them the most complete coverage, the most benefits that they can. All right, so next we're going to move on to the next part. So to start out, I'm going to ask you a few questions to get an idea of what you're looking for specifically. After that, I'll do some research for you and then come back with a plan for you. It may take about an hour to do the application. So the reason that you want to do that is because you want to let them know that it may take some time to go through the application process, so you don't get halfway through and then have to continue it later. They can, when you book a time to sit down with them to go through the applications, if you're doing it in a 2-call scenario, you want to make sure that they pick a time where they're going to have time. If you're doing it all at once, you can skip that part. But in this particular case, what we're looking at is you're brand new. So what you're going to want to do is break this up into 2 calls. One where you call them right now and get their information. You're going to book a time to meet with them again, and then you're going to come back with all the solutions and explain that, and I'll go in full detail on how to do that. But the way that you want to schedule this is not by asking them, hey, what's a good time that works for you? You want to say that, but you want to give them options. You always want to be in control of the call. So when I say what works best for you, I'm going to give a couple of days after knowing my schedule. All right, we have Thursday or Friday. Which works better for you? Oh, Friday? Okay, great. So morning or afternoon? If they say morning, okay, I have a time at 9 o'clock and 11 o'clock a.m. Which works best for you? And then they go ahead and tell me, and then at that point, you schedule that. So now you're going to move on to the questions. All right, so Were you looking for coverage for just yourself, or are you in a family? How many people need coverage? What are their ages? This is basic information you're going to need to run a quote. What is your expected income? If they're self-employed, it's going to be the line 11 on their tax return, or you can say adjusted gross income. It is going to affect their subsidy, so this is an extremely important question. And then how many people do you have on your taxes? And if you're married, do you file jointly? Then that's very important, because if they're not filing jointly, then they're not going to qualify for the subsidy. So you need to make sure that you find that out and that you let them know that as well. So do you currently have any health or life insurance coverage? And then you want to get the details if they answer yes. So what's the size of the company? If they have work insurance, what do you like about your plan? That's going to be a good one, because then you want to find plans that also do that. And then what do you dislike about your plan? And that's going to be a really big question too, because a lot of people have work plans, but they just don't like their work plan. And the last thing that you want to do is get a plan that mirrors their work plan when they don't even like their work plan. All right, so if you had to choose between these different types of coverage, which would you prefer? An expensive plan that covers everything, or a plan that costs less but you pay more if something happens? So the main reason that you're going to want to do this and ask this question is because you need to determine if they're more concerned about the benefits or the costs. Some people don't go to the doctor that much. All they want to do is get the lowest plan possible. Others don't mind paying that extra premium per month because they regularly have to go back, or they know that they're going to have something that's coming up. All right, so have you or anyone that is going to be covered been diagnosed, treated for, or taken any medications for the following conditions: heart attack, stroke, TIA, cancer, diabetes, neuropathy, ALS, high blood pressure, high cholesterol, or used tobacco? Now, again, the reason for this is going to set you up for things later on, because if they do say that they need life insurance, then you're going to need to know this information to see what they can qualify for. The same with supplements. Now, as far as the ACA goes, no pre-existing conditions are taken into account, so you don't have to worry about that. But if they ask you, why are you asking me these questions, you can say, hey, sometimes there's programs that will allow you not to have to pay anything out of pocket if you go to the hospital, but if you have any of these conditions, you may not qualify, so I need to know that. All right. So what is your and everyone being covered's height and weight? Again, that ties more into life insurance, sometimes with the supplements. Are you more concerned about doctor's visits and illnesses, or major things like cancer, heart attacks, strokes, and major accidents? And then how many times do you see the doctor per year? And how many and what medications do you take? And so the main reason for this is to figure out if they're more concerned with doctor visits, more concerned with hospitalizations, and to narrow down what they're looking for, because the last thing that you're going to want to do is give them a really expensive plan because of the doctor copays and doctor visits when they don't care about that. You may be able to get one with a low out-of-pocket maximum, but it just doesn't really cover doctors that well. So you really want to tailor this to their individual needs, and these questions help with that. All right, so next, do you have anything in place to help pay bills if you're unable to work due to a serious illness or injury? Now, the reason for this is there's a little bit of psychology behind it. One of the things that I tell every agent that I work with is that our job is actually to help people to think about things that they normally wouldn't think about. And so a lot of times what happens is when somebody gets health insurance, they say, my health insurance is great, I don't have to worry about it if I get sick, but they forget about the fact that those health insurance policies don't pay their bills. And so there are life insurance policies that are available that will pay out if someone gets seriously sick or injured. And then more importantly, there's also supplements that are there to pay those specific things and pay certain amounts if they get critically ill or injured. All right. And now, do you have a primary care physician? Will be the next question, because sometimes people want to keep their primary care physician, which leads into the next question. Are you willing to switch doctors if it will save you money? All right. And that actually is probably one of the biggest questions if someone does have a primary care physician. And the reason for that is some people just do not want to switch their doctors. And the last thing you want to do is put somebody on a plan and then they go to use it with their doctor and now they can't use it. All right. So if there was an emergency, do you have anything to pull from to help cover costs like 401k, IRAs, mutual funds, money market, or significant savings? Now, the reason for this question isn't as obvious as the others. The reason you want to ask this is, for one, they may have to pull from that money if they get sick, so it even more reinforces their need for some type of supplement plan if they're worried about how they're going to pay their bills if they get sick or injured. The other thing is sometimes a lot of people don't know that there's great retirement plans, or there's other things that they can do to prepare for retirement that they're unaware of. And this sets that up. So let's say somebody has an old 401k, there's things that they can move that into where it'll grow. There's a lot that goes into that, and that kind of has more to do with the I still call it advanced marketing type thing, the advanced retirement systems. There's those types of things, and that's why you want to build your knowledge of that. But we're not going to worry about it so much here. But you will want to get that information, because if they say, yeah, I don't have anything for 401k, I don't have any type of retirement savings, I don't have anything to pull from if something were to happen to me, but I am interested in that, then you can get with one of your leaders and they can tell you where to go from there. But always ask that question. All right, so the next one is currently, after bills and expenses, what do you feel you have left over at the end of the month? This is setting up for the next question here, which is, of that, about how much are you able to spend on health insurance? And a range is fine to give you an idea of what to look for. Now, you're really going to want to know that, because you don't want to put them in a plan that's too cheap or too expensive. Meaning, if somebody has $1,000 a month and you put them on a really basic plan for $200 a month, they may get upset about that. And if you try to put them in $1,000 a month plan and they can only afford $50, of course they're going to get upset about that. So it's good to know. I remember one time I actually got into a mini little argument with one of my clients, and this question is what saved me, because I quoted her something. She said she wanted more coverage. I went over another plan that was more expensive, and she said, well, why are you assuming what I can afford? I was able to say, well, no, I asked you how much you wanted to spend on your health insurance, and this is what you told me. So I was just staying within the guides that you gave me. And then she laughed, said, you know what? Okay, yeah, I did say that. And then we had a great rapport after that, had no questions, no problems whatsoever. And she's one of my best clients. So that question can really be a lifesaver. Now, once you've got that, now you're setting up for the next appointment where you can go back and do your research. And it's very simple. Okay, great. I have a good idea of what to look for. I'll put together a comprehensive plan and we can go over it on Friday at 11 o'clock. Make sure you put it in your calendar and I'll send a reminder. When we go over it, I may have some follow-up questions and we can make tweaks to it to make sure it fits. After that, I'll help you submit the applications needed and get you and your family protected. Make sure you save my number so you know it's me when I call, okay? Now, with that, it's pretty simple, pretty easy to understand. You just want to reconfirm the date that you set earlier, and then you want to make sure that they put it in their calendar so that they don't forget. And then also you'll want to send reminders to them throughout. Now, I personally use Calendly and it does it automated. If not, you'll just have to make sure that you put it in your calendar to remind them of the appointment that's coming up. All right, so that's the basics of getting started and getting all the information. There will be a whole separate video on how to actually choose a plan and put those plans together and how to present those. In the next video, we will talk about how to present the plan, but we're only going to do it from a high level. The reason for that is you'll learn how to actually put the plans together and how to describe those in a separate video. But until then, I hope you all have the great rest of your day, and I'll see you next video.